Hello everyone. Now in today's video we're going to talk about some of the tips. I'm going to share some of the tips that are going to be really useful for you if you are studying for your PLAB2 exam. Alright, and these are the tips that I've used myself and I was able to pass PLAB2 in the first attempt by God's grace. So these are the tips that will really help you, and these are actually already proven to have worked. Alright, and they'll help you to pass the PLAB2 in the first attempt hopefully. Alright, so let's start with the tips. But before I do that, if you are somebody new here who have come and you are coming to my channel for the first time, then thank you so much for clicking on this video. I hope you'll find value in this video. And the second thing I really want you to do is subscribe to my channel, so that if whenever I upload any new video regarding the PLAB exams, whether you're doing PLAB 1 or a PLAB 2 exam, or you're a medical student who just want to find out about some other medical topics, I make video related to that as well. So make sure to hit the like button and the subscribe button as well. So now let's start with the tips. So the first tip that I've got for you in terms of these PLAB 2 tips is scan the question for the vital information. Alright, and now, well, the question that pops up into the mind is obviously, what is the vital information? So let me explain what the vital information is, what I mean by that is. Alright, so when you are outside the cubicle, outside the station, you will have a minute and a half to actually read the question. Alright, and there some of the vital information that the question or the scenario that has been given to you outside the cubicle, there are some important bits that you have to remember when you actually read that question. Alright, and I will actually just tell you to the biggest tip is to read the question or the scenario at least 2 times or 3 times, if not more. Alright, okay, and so what is the vital information that you are scanning for in this case? So the first thing is obviously, even before I go into the age one, obviously I want you to remember the name of the patient. This is extremely vital. You just won't believe how many students or how many doctors, when I'm doing the PLAB2 mock stations, when I'm taking the PLAB2 mocks, how many of them actually forget the name of the patient, or they are pronouncing the name of the patient incorrectly. And these kind of things obviously matter, and it is very important to remember the name of the patient first thing. Alright, and what you can do is, one of the tips that I can give you guys regarding that is, when you're about to enter the station, so let's say you have a minute and a half to read your question. When you're about to enter, just have a quick glance at once again, just to make sure that you've got the name right. Alright, okay, now the second thing that is very, very important in terms of scanning for the vital information, the next point that you can see on the screen is age. Now, you might ask, well, why is age important? Alright, the reason is that age is obviously important in order to formulate your differential diagnosis, in order to ensure what kind of questions you're going to ask the patient once you are inside the cubicle. Alright, let me give you an example to clarify this. Alright, so imagine if there's somebody, if the patient's age is 60 or above, obviously, and if they are coming with chronic cough, let's say, so the question tells you that the patient is presenting with chronic cough which has been ongoing for at least, let's say, 2 months, right? And the patient is above 60. Alright, now this is something really important, because some of the differentials or some of the diagnoses can become extremely vital when we consider the age. So if there is a patient who is above 60, obviously we are thinking of something like cancer, something sinister like cancer. It is one of our important differentials, and we have to keep that into account. So alright, so that is why age is an extremely important factor. When you're reading the question, read very carefully and take into account the age factor. Obviously, the gender of the patient is obviously very important, because some of the diseases or some of the conditions are more prevalent in one gender compared to the other. Alright, so obviously that also helps in that. Alright, the presenting complaint, what are they coming with? And the reason is obviously the presenting complaint is what they present with to you in the hospital or in the exam station. Alright, and what you want to do is, obviously you want to think of the presenting complaint, you want to think of all the conditions of the differentials, you want to think of and what questions to ask. So these are some of the things when you are outside in the cubicle you have to remember. Name of the patient, age of the patient, gender of the patient is extremely important, and the presenting complaint. All right, so these are some of the vital information that you want to pick out from the scenario, from the question, while you're reading the question outside the cubicle in your PLAB exam. All right, so I hope that was clear. Let's move on to the next tip that I've got to you, which is very, very important. Okay, so the next tip number 2 that I've got for you is obviously use the preparation time extremely wisely. All right. Now, I've already mentioned before as well that you guys are going to get a minute and a half to read the question outside the cubicle before you even enter and start talking to the patient. All right. And it is extremely important to use that time, that preparation time that you've got outside the cubicle wisely. Now, obviously, you're going to ask me the question, what do you mean by using wisely, and what can we do to make sure that we are using the time correctly? So the first thing is obviously when you're outside the cubicle, you want to plan out your consultation. All right. So let me give you an example to clarify this. Now, different patients or different situations in the PLAB2 stations require different approach. All right. So, for example, let's say if there is a patient who has just come to get her results, all right, and she was experiencing some unintentional weight loss, and now she has come to pick up her results. All right. Now, this approach, the approach that you're going to use here is obviously going to be very different from somebody who has just come in for a routine checkup. All right. Okay, so in this lady, obviously, it is like a breaking bad news station where you're supposed to give some kind of bad news. Probably the results show, the biopsy results probably show that they have cancer or something sinister like that, unfortunately. So it is very important that you plan out your consultation. What is your initial approach going to be? How are you going to go and greet the patient? What your tone will be? What your body posture will be? And obviously, it's going to be different for different types of situations. So if you are talking to a patient where you are breaking a bad news, obviously the tone is going to be very low, it's going to be very slow, and you have to take pauses. All right. Whereas if you were doing a consultation for somebody who's just coming for a routine checkup, it can be like, you don't have to really stress a lot or, take a lot of pauses and things like that. And your approach can be very different as well. So it is extremely important to plan out your consultations while you are waiting outside the cubicle. All right. The second thing that I want to talk about is very important while you are preparing or using your preparation time is to just think of all your differentials. All right. So if whatever the patient, imagine a patient has come up with a headache, okay, the presenting complaint that they've given you out in the question is obviously headache, okay. So in that time, while you're preparing outside, it is must that you think of all the differentials, all the important differentials. So imagine if the patient is coming with very severe headache. So things like subarachnoid hemorrhage, maybe it is just migraine even. Sometimes that can be even very severe as well. All right. But subarachnoid hemorrhage is a very important differential. All right. It can also be other things like, meningitis and things like that. So what you want to do is, obviously, you want to ask about all the other associated symptoms as well. But what you have to do is, while you are waiting outside, while you are preparing and trying to come up with all the differentials, it's just make a list in your head. Okay, what questions I'm going to ask? What are my differentials for this kind of presenting complaint that the patient has presented with? What are some of the diagnoses that I need to rule out? So these are the kind of things that you want to think about. You want to make sure that you have already planned them out while you're outside the cubicle rather than going inside and just thinking, okay, what do I ask now? All right. So these are the kind of things that you want to think about. All right. So thinking about your whole consultation, your approach, and then thinking about your differentials. Now let's move to the next step, which is obviously very important. And this is something that when I do the PLAB2 mock stations, it is something that most people struggle with. And tip number 3 that I've got for you is that you want to make sure that you show the examiner that you are an extremely safe doctor. The patients are extremely safe with you, all right? You are not putting patient safety at risk at any time. All right, while you're doing the consultation as well, you are ensuring and you're making sure that everything that you is not causing any kind of harm to the patient or putting the patient in any kind of unsafe conditions. All right, okay, so let me explain a little bit more. So how are you going to show the examiner in that limited time that you've got in the station that you are a safe doctor? So the first thing you are going to do, for example, if you've got a history taking station, all right, the one very good way that you can actually show the examiner that you are an extremely safe doctor is by trying to rule out all the red flags. Now, what are the red flags? Well, the red flag symptoms are symptoms if they are present in history, or the signs that are present during the examination, they actually point to something sinister or something more serious. Okay, they point out to a more serious condition. So, imagine if the patient has come with chronic cough, all right, the presenting complaint is chronic cough, and they have been having chronic cough for quite a while now, and they also have, let's say you want to ask about things like weight loss. Have they noticed any weight loss, especially if it's unintentional? All right, because so this weight loss or unintentional weight loss is a red flag symptom, because it can mean that the patient has some kind of cancer. All right, okay, you also want to ask about things like anorexia, because changes in appetite are also very common. All right, so these are the kind of symptoms, or these are the red flag symptoms that you want to make sure that you rule out while you're taking the history. And if you do that in your PLAB2 station, let me show you guys that it is an extremely effective way to show the examiner that you are a safe doctor, and this is what they are really assessing for in the PLAB2. They know you've got the knowledge, that is why you passed PLAB1. Now they want to see if you can put those principles that you have learned in theory into practice. All right, and they want to assess your safety as well. And while doing the PLAB2 mock stations, I make sure when I'm marking the candidates, when I'm marking the doctors, I really make sure that they have ruled out all the red flags for that particular presenting complaint. All right, so let's move to the next point, how you can show that you are a safe doctor. The second thing that you can do to show your safety to the examiner is obviously when you are going to pass your PLAB2, by God's grace, you are actually going to work at a level of FI2. All right, okay, and there are obviously more senior people there as well. Okay, so if you're unsure about anything, it is extremely important to actually involve your seniors. All right, okay, so imagine if there is a station and you're talking about a particular medication in the PLAB2 station, all right, and you're talking to the patient and there is something that you're not sure of. You know, the biggest mistake that most of the PLAB2 doctors, most of the candidates make is the fact that they just try to show that we know everything, because they think that if we don't give an answer, we're obviously going to lose mark. Well, yes, that's true in a way, but if you are telling something wrong to the patient, you are putting patient safety at risk, and you are not a safe doctor. And you are not actually aware of the fact that you have some limitations in your knowledge. All right, so that's not a good thing. But in PLAB2 stations, in PLAB2 exam, what you want to do is you want to make sure that you involve the senior. So if you are not sure about something, let's say they've asked about some particular side effects of a medication in the station, and you're not sure, what you can do is just apologize to the patient very politely and say, I'm extremely sorry that I am not really sure of the answer for this question, but do you mind if I actually go and talk to my seniors and I get back to you with an answer? Is that okay with you? All right, and obviously the patient's gonna say it's fine, okay? Or you can just say to the patient, I'm not really sure, I will make sure of the answer. I will just ask my seniors regarding this to make sure that I'm giving you the right information, and then I'll get back to you. Now, I'm not saying that you want to do it with every station and with everything at all, because obviously they expect you to know something. Even as a junior doctor, you are expected to know certain things. You need to have a certain level of knowledge, and that's what they're trying to obviously assess in PLAB2 as well. But at the same time, if you're not really sure, it is better to actually involve your seniors and talk to them and give the correct level and the correct information to the patients, rather than giving something that you are not really sure about. All right, and giving wrong information is actually it's a critical mistake that you can make in PLAB2 exam. All right, so just accept your limitations and involve your seniors. Ask for help. This is something that you want to do when you have started working as an F2 level and you've passed your PLAB2 already as well. That's something that's going to go with you for life, okay? All right, so it's very important. All right, so these were my 3 tips that I had for you guys. I hope you found them useful. If you did find them useful and you are preparing for your PLAB exams or you're a medical student, all right, just please don't forget to subscribe to my channel. It really helps me. It motivates me to make more videos. All right, hit the like button as well. If you've got any comments or any questions regarding the PLAB exams, just put them down in the comments below, and I will try my best to answer most of the comments that I get. All right, so I will make sure that I do that. Thank you so much for watching, and if you have any more questions, please make sure that you just put that in the comment section below. Thank you so much for watching this video. Bye bye.